Okay, why don't we get started? I see we have a number of attendees, participants here, so it's great. Welcome, everyone, to this Climate Academy from the New Jersey Climate Change Resource Center. My name is Jean Herb, and along with my colleague Marjorie Kaplan, we co-direct the Climate Change Resource Center. Marjorie will put the link for the Resource Center in the chat, and we hope that if you're not on our email list, that you'll sign up so you'll receive news about additional webinars like this and other interesting news and events. The Climate Change Resource Center was established in 2020 by a law adopted here in New Jersey, which was based on the concept of bringing the expertise and the capacity of the academic community to address the wicked challenges associated with climate change adaptation and emissions reductions here in New Jersey. And so we have the great fortune of being able to work with some experts, including the two who will be talking today, who are members of our team, along with other researchers from around our university at Rutgers, as well as researchers, stakeholders, vulnerable populations, policymakers, and decision makers from across the state and federal agencies. So today what we're going to do is we're going to give you an overview of a new product that we've put together called a Heat Vulnerability Index. Before I turn it over to Dr. James Shope, I want to just give you a little bit of background. The development of the Heat Vulnerability Index was something that we decided to take on because we saw how in other locations across the country, heat vulnerability indices were being used to connect addressing climate impacts with working towards producing benefits in terms of public health and particularly in terms of health equity. And so this concept of a heat vulnerability index creates a practical but data-driven tool that we hope can be helpful to all sorts of end users to try to look for solutions to address climate, both with regard to adapting to and building resilience to climate, as well as reducing emissions in ways that can deliver health benefits, particularly to populations that suffer from health disparities. We want to thank the people from the New Jersey Department of Health, from the New Jersey Department of Environmental Protection, and from our own School of Public Health, who served as peer reviewers on the Heat Vulnerability Index. Here's something I really want to stress. This is our version 1.0 of the Heat Vulnerability Index. And what you're going to see today is Dr. Shope's background on the development of the Vulnerability Index, what it's composed of, how it can be used. We've asked him to not go into tremendous detail on the science behind it, but if some of you want some science, I'm sure he'd be happy to do that. And then we're going to turn it over then to Pritpal Bamhrah, who is going to walk through some of her initial applications of analysis using the Heat Vulnerability Index. This is the first applications of the Heat Vulnerability Index, so it is just our start. What we would love to hear from you also is where you see improvements or enhancements that might be needed to the Heat Vulnerability Index in order to make it more useful to you, and then also other types of analysis that either you want to take on or you'd like to see us take on. So with us today is Dr. James Shope, who is the applied climatologist with the New Jersey Climate Change Resource Center, and Pritpal Bamhrah, who is a senior research specialist, also with the Climate Change Resource Center. My co-director, Marjorie Kaplan, is manning or personing the chat box, and so you can put questions into the chat, and Marjorie will be keeping an eye on it. James is going to talk for about 20 minutes. Pritpal is going to talk for about 10, and then we'll open it up for questions and comments and discussion. And before I turn it over to James, let me just give a shout out to Matt Drews, who is the person who keeps us on track and makes sure that these webinars run smoothly. So thank you, as always, Matt. So James, I'm going to turn over to you.
All right, thank you very much, Jean. I'm just going to share my screen here. And it's going to be this one. All right, can everyone see this?
Yes.
Awesome.
Not yet for me. I still see your face.
Now, yeah, no, not. I saw it for a second.
Oh, sorry, it's giving me issues. I have multiple computer screens here. That's
But it's a very nice face, James.
There it is.
awesome.
Oh, good.
There we go. All right. So as Jean mentioned, I'm Dr. James Shope. I'm the applied climatologist. And so I'm going to walk through all the background on why we would want a heat vulnerability index, what goes into it, and then Pritpal is going to kind of take it from there and show you some of those applications, as well as how to find it on our website. So to start with, let's look at summer temperatures here in New Jersey. So pictured here is the average daily maximum temperature during the summer season for New Jersey from 1900 to 2022. I'm actually going to turn on my little pointer here so I can show you what's going on screen. And so the red line's the actual yearly measurements. The green line is a smoothing trend through that, just so we can see that trend over time more easily. And then the black line here is the mean of the last century for comparison's sake. And so what you can see, especially focusing in on this green line, is that temperatures in New Jersey during our summers have been increasing. And since about the 70s, 80s, they've been increasing at a somewhat stronger rate. And since 1900, our summers have warmed on average, the summer maximum temperatures have warmed on average by about 3.5 degrees Fahrenheit. Now, we anticipate that trend continuing into the future. Pictured here on the bottom is the average annual temperature in New Jersey. That's what's in orange here, is the average observed annual temperature in New Jersey, relative to a baseline period of 1901 to 1960. That average is what this black line is. And so it's relative to that period. That's why we have some positive and negative numbers here. The gray shaded region behind this curve is model reconstruction of that historical period, just to show that it matches up pretty well. And if we continue with those model simulations into the future with lower and higher greenhouse gas emissions, therefore leading to lower and higher amounts of climate change, by 2100, we expect that New Jersey's average annual temperature is going to be about 2 to 8 degrees warmer for lower emissions and about 8 to 14 degrees warmer for higher emissions. And what this means for our extreme temperatures during our summers is that if we follow this red trajectory, by the middle of the century, about 70% of our summers are going to be warmer than any before 2006. And then by the end of the century, about 90% of our summers will be. If we globally tamp down on greenhouse gas emissions and follow a lower trajectory, those percentages drop, but we're still going to see a number of superlatively hot summers moving forward. If we want to think about this in terms of other types of metrics, that's a little bit easier to parse. We can look at the number of days per year where the whole of New Jersey is above 95 degrees Fahrenheit. So the daily average is 95 degrees or more. And over the period of 2001 to 2020, that average per year is about 1.8 days. By the middle of the 21st century, with moderate greenhouse gas emissions, closer to that green curve we saw earlier, it's about 2.8 days per year. And then following higher emissions, broadly that red curve we saw before, it's closer to 5 days per year. Now, this graphic on the right here shows what that spatial pattern may look like for this higher emissions, middle of the century change from historic to projected number of days per year above 95. And what I want to call your attention to, and I'm going to come back to, is the whole of the state is not warming at the same rate. There's actually a geography to this particular hazard. We can see that around Camden, just across the river from Philly, it's anticipated to be anticipated that we're going to have more days above 95 compared to, say, in Atlantic City, where that increase is smaller, where you have coastal effects. So keep in mind that we have this geography of this hazard and this change in this hazard. And then finally, at the end of the century, this is where we really begin to see our temperatures diverge based on emissions, with moderate emissions being about 5 more days per year above 95. And then with higher emissions, the average is closer to 18. So a very noticeable effect And we care about this change because heat and extreme heat has direct consequence for human health. So as temperatures rise in New Jersey, we expect to see increased incidences of heat-related illnesses, hospital admissions, and deaths amongst our most vulnerable populations here within the state. Part of this is due just to heat exposure. The warmer it is, the more heat illness you expect to see. The other thing that we want to consider is as the atmosphere warms, its ability to hold moisture rises. So we anticipate that as our summers warm, they'll also have the ability to become more humid. The more humid it is, the less effective our bodies are at cooling off from perspiration. Basically, when we sweat, that sweat evaporates, and that evaporation is what cools us off. That process doesn't work as well when there's a lot of moisture already in the air. And so that contributes to a higher heat stress risk for the individual. Other things that we want to consider is worse air quality moving forward. Certain pollutants like ground level ozone are created at a higher rate on very hot days. And those types of pollutants can exacerbate asthma, other respiratory illnesses such as COPD, and cause hospitalizations for those chronic illnesses. Of other particular interest here in New Jersey is the urban heat island effect. So extreme heat is amplified in urban and suburban sectors, basically areas where you have pavement, concrete, or the roofs of buildings, collectively what we call impervious surfaces. In a high density area, like a city or in the suburbs, you will get temperatures that are warmer than the surrounding forested or rural areas. This is because those materials absorb solar radiation and then re-radiate it back out in the local area as heat. And so pictured over here, we have a land surface temperature map. It's from Sustainable Jersey, showing hot areas here in red throughout the state. And you can see they broadly correlate to our more urban areas. And again, this is just land surface temperature. So it's not the actual air temperature, it's literally the surface of the ground itself. But you can see there's this high correlation between urbanicity and heat. And so since a large portion of New Jersey is urban or suburban, we expect to see these extreme heat health impacts exacerbated in the future. So now I want to tune back into the distribution of these hazards. So this is the same graphic we saw before, showing the change in number of days above 95 across the state by the middle of the century for high emissions. The actual emissions scenario here doesn't matter. It's mainly as an example. So we have the geography of this particular hazard and the change in this hazard, but we also want to consider the geography of the vulnerability throughout the state. So on the left here is the CDC Social Vulnerability Index, where yellow is lowest socially vulnerable, blue is highest socially vulnerable. And what I want to call your attention to here is that it's not equally distributed throughout the state. There's definitely areas that are more vulnerable within the state of New Jersey, and we want to consider how that vulnerability is paired with this environmental hazard, and consider both of those geographies together. But the CDC Social Vulnerability Index is it's a useful tool, but it's more of a broad catch-all for this type of vulnerability. So we want to look at something that's a vulnerability measurement specifically geared towards heat. And what you're going to see is it employs a lot of the same information that goes into the CDC Social Vulnerability Index, but has more information that's geared towards looking at heat vulnerability specifically. So let's actually define heat vulnerability. And broadly, it's the degree to which a community or an individual is prone to a negative health outcome from extreme heat. And I really love this honeycomb graphic here from Lim and Skidmore that shows how a heat hazard is filtered through environmental conditions, population, social, socioeconomic conditions that result in a finalized societal impact. And all of that goes into informing hazard mitigation, adaptation, and intervention strategies that you see here in blue. So I really like this cycle graphic here. Now, one of the first things that you may ask is, well, if we're interested in heat health outcomes and who's most vulnerable, why don't we just look at health records? And it's useful to do so, but it's often difficult to tie heat exposure into adverse health outcome information. This is primarily because heat emergencies are not often attributed to heat. So as an example, say that someone went into the emergency room for a heart attack. In medical records, that heart attack is listed as the primary cause of why they came in. That makes sense. But if that heart attack was exacerbated by heat, that's often, first off, hard to tell if that was a contributing factor or not. And if it was, it's often not recorded. We see that in the literature as a confounding factor in terms of determining how much extreme heat has been affecting the health of Americans, for example. Now, we do have information for a recorded number of instances of heat-related hospitalizations and emergency department visits. We have here from NJA Department of Health for 2004 to 2013. So we have hospitalizations in red and emergency departments in blue. And you can see that there's a trend here of them both increasing, which is what we would expect to see as our climate warms. But because we know so many of these other health-related factors, heat-related factors may not be recorded, these numbers could actually be substantially higher. So lacking this really solid health data that we can use, we look often towards other determiners of vulnerability, like environmental conditions, socioeconomic conditions, or demographic factors. So if we're going back to this honeycomb graphic, it's really these 2, 3, and 4 pieces here that I've highlighted in red. So we want to quantify those to help comment on relative vulnerability throughout the state. And we break those into 3 broad categories. The first is exposure. That is the physical environment. You can think of it as like the built environment around you, or maybe the climate that can exacerbate negative health outcomes from extreme heat. Then we have sensitivity. That's the degree that an individual may be affected by extreme heat. And then adaptive capacity, and that's the ability to basically respond to extreme heat. And where those overlap in terms of their negative outcomes is how we define our heat vulnerability. So what I'm going to do is walk through each one of those big categories, and the individual variables, or what we call indicators, that contribute to those categories within the New Jersey Heat Vulnerability Index. So I'm going to start with that exposure category. And again, that's our physical environmental stressors. And in the New Jersey Heat Vulnerability Index, that contains higher average annual temperatures throughout the state. Certain parts of the state are warmer than others. We consider that. We consider air pollution. As I mentioned before, extreme heat combines with air pollutants, generally tailpipe emissions and the like, to help produce certain pollutants like ground level ozone, which is bad for people with respiratory illnesses. So we consider that as well. And we consider impervious cover throughout the state by census tract. So here in this image, this is showing a ratio of tree canopy cover to impervious surface coverage, where green is more canopy cover and brown is more impervious cover. And what you can see is this highlights our urban areas pretty well and aligns with our expected heat island locations. Now, that's not necessarily true along the coastline. Here, there's a high impervious amount, but with onshore coastal winds and the like, the actual heat island is not as apparent there. It just doesn't manifest in that location. But we consider these into our exposure metric. And then we move to our sensitivity metric. Again, this is more of an intrinsic degree to which you may be affected by extreme heat. So we consider information like the percent of the population above the age of 65 or below the age of 5. Those populations are less able to thermoregulate their bodies and therefore are more prone to heat stress during extreme heat. People living alone who may not have contact for help during extreme heat, or people in outdoor occupations who are more exposed directly to those heat effects. We also consider chronic health conditions like asthma, diabetes, or heart disease rates, those conditions that are exacerbated by extreme heat, as well as people with disabilities who may not be able to respond as effectively during any sort of emergency, but in this case, looking at, like, say, a heat wave. And then we also consider housing units. Basically, older homes and housing units are used as a proxy for lack of air conditioning, especially central AC. And those older homes tend to have reduced insulation, creating an environment that's a bit more prone to extreme heat exposure for an individual. And then we consider adaptive capacity. Again, the ability to respond to and recover from extreme heat. This is primarily driven by socioeconomic factors, like percent of people below poverty line, or unemployment, or without a high school degree. Generally, there's just like no financial ability there to respond to extreme heat based on socioeconomic status in this case. We also considered other demographic information, such as percent of the population that's non-white. Communities of color have historically been underserved in terms of hazard mitigation and environmental mitigation and intervention strategies. And we also consider linguistic isolation. A lot of our heat health information is presented in English, or in some cases, sometimes Spanish. And if a person doesn't speak English very well, they may not have all the information they need to adequately respond to or be aware that a heat wave is expected to come or how bad it could be. And then we also look at lack of health insurance. People without health insurance are less liable to go to the ER if they have any sort of emergency problems, and that can further exacerbate any sort of health impacts from extreme heat. Now, we pulled these data from a number of different places, like the US Census, the CDC's Environmental Public Health Tracking Network, the US Forest Service, and the USGS for the land cover data, and then we get the climate information from Oregon State's PRISM Climate Group, because it has very good spatial coverage. I'm not going to drill down into these much more than that, though. So we take all that information and combine it into the aggregate heat vulnerability index. And so it combines all those different factors into one metric that summarizes everything in terms of what contributes more to worse heat health outcomes. Now, we do this at the census tract throughout the state of New Jersey, but it's a relative comparison is what we're generating. New York State has its own HVI. The city of Philadelphia has its own HVI. These are not directly comparable. So it's within the bounds of New Jersey itself. But within those bounds, it helps us identify our most heat vulnerable communities that can be targeted for interventions and the like. So to get in a little bit into the process of how it was generated, we take each one of those indicators that I discussed before, and we transform each one of those data sets. So here on the left, I have the number of census tracts throughout the state on the y-axis versus the percent of each one of those that are below the poverty line. And you can see that we have a very skewed distribution, as in most of the data is on the left side here, and we have a long tail coming off to the right. Now, on one hand, this tells an interesting story of most of our census tracts in New Jersey don't have a high percent of people living below the poverty line. That's a good thing. But statistically, it makes this much harder to compare and process with other data sets. So what we do is we take these data and do a box-Cox transformation that converts it into a more normally distributed distribution. It changes what the x-axis means, but that's okay because we standardize all of the data. I'll get into that in a second. But what it does is it controls for this skewed distribution here that could overemphasize certain census tracts, as well as it helps account for certain outliers when you get very unique census tracts, and it makes everything much more comparable. So to walk through a schematic of how the HVI is constructed, for each one of our big categories, we have a number of indicators that I've discussed before in each one. So for exposure, I only list 2 here, but we discussed 3 indicators. So this is just by example, but in the exposure, it does include all those that we have discussed. So indicator 1 could be impervious cover. Indicator 2 could be air quality. Same for sensitivity. We discussed a number of contributing factors to sensitivity, but as an example, indicator 1 may be people over the age of 65, or it could be indicator 2 could be chronic health conditions, indicator 3 could be older homes. And then same for adaptive capacity. Indicator 1 could be in linguistic isolation. Indicator 2 could be socioeconomic status. Regardless, every single one is transformed to that normal distribution via Box-Cox transformation. And then we use the z-score standardization. Don't really need to get into that too much, but broadly what it means is it takes those data and ensures that they're all within the same units and are comparable. Because you don't want to have some of your data in a percentage, some of it in absolute numbers, and when you start trying to combine them, everything gets a little off kilter. So standardization is a way of ensuring that they're all comparable. And then we simply average them within those bins. So we end up with a composite exposure, sensitivity, and adaptive capacity score. And we do the process again with the standardization to ensure these are all, again, within the same units, and then average those together to get our composite heat vulnerability index. Now, there's a number of different ways to create the heat vulnerability index. And if you were to look in the literature, you were to look at other examples, some states, some cities will produce theirs via a principal component analysis, for example. And that is a much more statistically rigorous technique to produce the HVI. But in looking through the literature, in discussions with public health officials and discussions with other groups that have generated their own HVIs, they found that a principal component analysis, or a much more statistically complex approach, makes it much harder to communicate the results with practitioners and community managers and planners. So we decided to take this averaging approach because someone could look at their heat vulnerability index score for their tract or their community, backtrack out what of our big groups here contribute disproportionately to that vulnerability, and what indicators within that could be targeted for potential interventions. So we built this very much with the practitioner usage in mind. And to just show you what the heat vulnerability index looks like for New Jersey, it's pictured here on the right, where we have low vulnerability in yellow and high in dark blue. And when we produce the index, it actually does have numbers, decimal point numbers for each census tract. But there's always some degree of vulnerability that's not captured when you're doing a simplified metric like this. So rather than providing a strict rank of where each census tract falls, we instead bin them into 20th percentile bins, where 1 is low, high is 5, such that they're not overanalyzed, but you can still see these regional groupings and these locations of high versus low vulnerability throughout the state. Additionally, if you were to play around with the tool, you'll see some gaps in some census tracts. We removed census tracts with high group quarters, or people living in group quarters. This would be like college campuses, or for example, a state penitentiary, where the kind of information that we're feeding into the HVI is less applicable. And then, as I mentioned before, for coastal areas, there's a little bit of limited use here, as we would consider the impervious to canopy cover ratio. And in our coastal areas, again, that heat island is not as strong because of onshore coastal winds effects. Okay, so with that, that's the background on why we would want the HVI, what goes into it, and a brief overview of like what you need to know to parse this image. Now, Pritpal is going to get into some of the application and analysis of what the HVI can tell us, as well as where to find it on our website. So I'm going to turn it over to you now, Pritpal.
Thank you, James. Hello, everybody. My name is Pritpal Bamhrah, and as James mentioned, I am going to walk you through two things. One, where you can find the map and data for the heat vulnerability index, And second, how we use to analyze it. As Jean said, this is our 1.0 version. So we are just starting to take this data and analyze it. So the link that Marjorie shared in the chat earlier was for the New Jersey Climate Change Resource Center website. When you go there, you see the tab here, which says NJ Adapt. And fourth on this is NJ HazAdapt, which is our hazard mitigation planning tool. You click on that, you are taken to our hazard mitigation planning page. That's where you can scroll down and find heat hazard analysis. You can download the CSV file, which is the Excel file for both what James was mentioning, the point data, and also the ranking index system that was used in the mapping, which is 1 through 5. You can also download the shape file here for the whole state. Keep in mind, it's based on census tract. And this is where you can find the map on our portal. And with that first, I would also like to thank our partners at Office of Research Analytics who help us create these tools and make them accessible through our website. So once you click there, you are taken to this map, which is our HVI map. And this is our kind of default version of map with the municipal boundaries on. But I'm going to show that here, this little button is the layers tool. If you click on that, you can turn off the municipal boundaries and you can turn on the county boundaries if that's more helpful to you. And it takes a while to load up in there. So it's just like if you are taking a screenshot for this, for some kind of report that you're doing and you want to show it differently, you can play around here. I'm going to go back to the default view and turn the legend back on. So as to how to read the data, so as James has already gone over it, I'm just going to show you how it looks on the map and how you can read it on the map. So I'm going to zoom into Trenton. And you see it's mostly the HVI scale is very high here. So let's click on one of the census tracts. So the first information you see is the name of the census tract. Then overall heat vulnerability, it's 5, it's ranked very high. So you can see it's very high on the scale. And then this little bar graph pops up here, which actually kind of breaks it into the 3 feeding categories that go into, which are exposure, sensitivity, and adaptive capacity. It kind of gives you the ranking of individual factors there. And this is just a little write-up of what James walked you, what is exposure, what sensitivity is, what adaptive capacity is. It gives a little sentence about the rank of the adaptive capacity. And here is the real data that you can look at. So the overall HVI scale is 5, which is on the category it ranks high. The 3 contributors are then broken up. Exposure has a little E in front of it. On exposure, it ranks 4. And below exposure are 4 of the indicators that are the factors that lead to exposure scale. These are the values that kind of feed into the exposure. So impervious to canopy cover is 5. That means it's on the worst side. Particulate matter is 2, is kind of on the lower side. Ozone exceedance days are high, and summer temperatures are average, like medium category. Similarly, sensitivity and what factors go into them, and adaptive capacity. So that's all the data that you can see online on this portal. And you can zoom in and out and play with the map and focus on the areas that you would like to. And with that, I am going to go over to my presentation now and walk you through some of the analysis that we can do with this data. I hope you can see my presentation.
Yes, Pritpal, we're good.
All right, thank you. All right. So first thing, I wanted to kind of correlate it to the obvious urban heat island effect. So the map on the left is the HVI for the state, and the map that you see on the right is superimposed with the population density points. So it kind of very highly correlates with the areas which are urban centers. But it also highlights that there's a lot of areas in the southern part of the state which are rural in nature that rank very high in HVI. So this is a very interesting factor, and to kind of decode it a little more, I wanted to look at the contributors individually, which are exposure, adaptive capacity, and sensitivity. So I mapped them out individually. So for exposure, you can see on this table, these are the factors that go in to map the exposure. And this is a very interesting map that comes up where you can see it's like almost like a belt running from northeast to southwest. And also the densest, kind of the highest areas on this rank are the densely populated area, kind of almost a spillover from New York City here and Philadelphia here. And also we've taken air quality factors into it, and major highways like US 1 and I-95 corridor kind of run along this belt. So this was very interesting to see it visually on the map. Second, sensitivity. So for sensitivity, the factors that go in relate to age, health, living and working condition. And you see all of the lowest ranks, like the areas that are doing well off, are clustered in the center. And again, the southern New Jersey and the kind of more densely populated areas pop up as the places which are more vulnerable. And southern New Jersey has really high rates of disabilities and like all the asthma, diabetes, and coronary heart problems, and people working outdoor, which kind of maps them very high on this ranking. The third was adaptive capacity, which is spread all over the state. So along with the urban densely populated areas, again, the southern parts show up basically due to the socioeconomic factors that go into it. And again, here's a table that shows the factors that were considered. So as we took some factors of air quality, which were on the census, which were on the county level, I did want to lay on the major sources of air pollution points and see how they correlate. And as you can see, they really correlate highly, as 67% of the census tracts ranking 3 or above are where the major industries and or polluting facilities are related. So the people who are most vulnerable are also placed right next to the polluting industries. Another important thing is to look at the vulnerable places with respect to the overburdened communities, which is a data set that looks at EJ communities by NJDEP. Although similar factors go in within HVI and OBC, it was good to kind of spatially lay it out and see how it correlates. We can see that about 50% of the census tracts of our state coincide with overburdened communities, 75% of which are completely coincide with the categories of HVI, which is 3 and above. Low income is a major factor that goes into it. So 72% of the overburdened communities correlate heavily or are intersected by HVI 4 and 5. The other factor where there's a little bit of disconnect in this map that shows up, you can see the central part where the HVI is actually low, but the orange overburdened communities overlap. These are minority communities, which are not necessarily low-income communities. So with that, I would take you to the key takeaways that came out of this analysis looking at the HVI. First, it highly correlates to the urban islands, but it also reveals that there is high heat vulnerability in the southern part of New Jersey, which is primarily rural. So that does kind of emphasize looking at heat to a larger scale and not just concentrated in urban areas. areas along major cities, which are New York City and Philadelphia, rank the highest in exposure. Southern New Jersey, again, ranks high on sensitivity and adaptive capacity, mostly due to socioeconomic factors. And major sources of air pollution are clustered in areas with high HVI. With that, I would like to draw your attention once again that you can find this data on our HazardApp tool. This is the website. When you go under the hazard mitigation planning tool, you can download the CSV or the shapefile, or you can just click on the under the maps where it says NJ Heat Vulnerability Index, and that's where you go to the map. And as Jean mentioned, if you use this for your own analysis, we would love to hear how you are using it or how we can use it to better inform everybody. And thank you. With that, I would open it up for questions.
Thank you so much, Pritpal. Thank you so much, James. Hi, everyone. I'm back. I see we've had a very active chat box. During our presentations, Marjorie and I made the decision that because there's so much activity in this chat box and interest, we're going to send out to anyone who is participating today a little online survey that will sort of ask some of the questions I asked earlier about what additional kind of analysis would you like to see us do? What kind of analysis would you like to do that you might need some technical assistance on? Are you someone who might like to participate in a little group who are working together on applying the HVI, with us? So keep an eye out for that. We'll send that out next week just to get your feedback. So thank you so much. So I see that we have some super technical questions. So I think we're probably going to try to answer those if we can, but we're also going to answer some of the questions that will benefit lots of folks. So Marjorie, I'm going to turn it over to you. I see we've got about 15 minutes or so.
Yeah,
and if there's
fine.
questions that we can't answer, we'll report back to everybody.
So thank you. So we'll get through them. I think we can get through them pretty quickly. James, what do you mean by humidity, relative, absolute? And of course, we know they came from Professor Robot.
So as the atmosphere warms, you can have more just absolute moisture in the air. And what we found in just looking at historical information regarding summer temperatures and heating as it goes along, humidity has been correlated very highly, or it's been correlated to more humid conditions where you have the water vapor the water to actually turn into water vapor. And that's been correlated to worse heat health outcomes. Basically, the heat index increases. So the heat stress on the individual is amplified.
Great.
I know that's probably not as technical as you want to get into, but that's what I can answer right now.
Alan says that doesn't answer his question. Alan, do you want to type in what can you be more specific?
Maybe I'll also
Or-
suggest that Alan and James are colleagues, so maybe
So
Alan
they
can
can-
just shoot
they can-
James an email.
Yeah, they can talk. We had another question about whether or not using overnight low temperatures might be a better tool than using daytime highs for measuring heat stress.
So it's a bit of a mix. I've looked at this through the literature, and half the time, if you're like, say, looking at a heat wave and their impacts, literature will use daily maximums. Half the time they'll use daily overnight lows because your low temperatures can, it may be a better indicator of consistent heat stress because you're not getting that nighttime reprieve. For the heat vulnerability index, I did daily average temperatures, mainly because it kind of splits the difference between those two. For version 2.0 in the future, it's a consideration I want to look at though, moving forward.
Great. We had a couple questions about sources of data. So real quickly, someone asked about the source of summer average temperature normals.
That comes from Oregon State's PRISM data set. Pulled the data for 1991 to 2020, which is the most recent temperature.
And James,
Climate normal.
maybe for normal people, you could tell us what that
Yeah,
Morgan
so-
something or other is.
Yeah, so climate normal is basically an average over 30 years of data. And there's
Where does one find that?
so you can get that information from a number of different sources, depending on the scale that you're interested in. I pulled this information from Oregon State University's PRISM climate model. Well, the M in PRISM is model, but put PRISM climate crew. And you can just type that into Google and you'll be able to find that information very easily.
And then another source question was about the annual PM 2.5 concentration data. Where did that come from?
Pulled that from the CDC's Environmental Public Health Tracking Tool, which provides county level estimates, so not super high resolution, where there are coincident with the EPA air quality monitoring sites. For the counties that don't have those, they offer a modeled information product. So that is one piece that I do think I do want to improve upon, because I know that you can do remotely sensed air quality measurements that could provide a higher resolution.
And also we've been asked about, whether or not the methodology is available to view, is it written? And of course, and I put in the chat for DJ the link and everybody can get it. I put it in the chat for everyone about the methodology that James employed to develop the index. And also there's metadata available. So if you have questions about where the sources of the data are, you should be able to get it from there as well after this session. We also were asked about whether or not why the 1992 census tracts were used.
Because when we were pulling the health data for chronic illnesses like asthma and the like, had not been updated that were not available in more recent years since the decennial census tracts have been updated. So we just kept everything to the prior census tracts.
Great.
Oh,
It's not the 1992 census tract. It is 1,992 census tract is what Michelle is telling us.
so why was it kept to?
I'm not sure.
Yeah, I am unsure of like the
That's the
question
number
now.
of census tracts in New Jersey.
Right.
Thank you, Pritpal. Thank you, Michelle.
But maybe
it takes a village to build.
maybe
a
it's just
vulnerability index.
coincidence that the numbers are the same. I'm not clear.
But that being said, it is fortuitous that you brought that this question did bring up that, yes, these are the census tracts from the prior census that are being displayed, not the current one because of data limitations.
How's that? Great. And then somebody asked about why not using the New Jersey land cover data.
So there's specific land use land cover data for New Jersey. And in terms of how it relates to heat and health, we basically capture the relevant information by looking at the impervious to canopy cover ratio. Because what you would care about from that land cover would be urbanicity and residential neighborhoods and the like. And that gets captured pretty well by just looking at the impervious coverage. So I wanted to make sure that we weren't effectively double counting certain things. So those two were very highly correlated. So we removed one of those variables.
Terrific. So can you guys talk about some of the interventions? We had a couple questions about that and, what strategies are being used to address high heat vulnerability.
Yeah, so interventions, adaptation strategies, I always like to tell people are always local, because what each community is vulnerable to and the best way to address them is because what you use to address them really highly depends on what your local community needs. So in the literature, there's certain basic ones, like if you're worried about an urban heat island, planting more urban canopy or having more reflective building roofs is like a go-to intervention strategy there. For some of these other ones, it's a bit more nuanced. For example, for elderly people living alone, certain cities have conducted strategies of, during extreme heat, going around and knocking on doors and checking up on those folks just to make sure they're doing all right. That community outreach aspect. And then, of course, some of this is more entrenched into environmental justice or socioeconomic issues that are much harder to address than a simple day of intervention if there's like a heat wave happening. So those are just a few examples. What I would say is look through those indicators for your community and see what you think would be useful to address within your own community in terms of starting to figure out what kind of interventions may be appropriate.
And I would also like to add, you can like use our HBI map to look at your municipalities and kind of look at what kind of heat adaptation or climate change strategies you are using within your plans. And if it wasn't an urban heat island, but it shows up that it's high on heat vulnerability index, I think it's a good kind of measure to start thinking about having these adaptation strategies in the plans to help the residents.
Marjorie, I'm keeping an eye on the time, so we might want to, if there's maybe one more question or topic, but then we should probably move towards.
Right,
closing
and
out.
so I think, Rachel DeFlumeri, hi Rachel, from New Jersey Department of Agriculture, is making some interesting suggestions about, discussing vegetations, green roof, projections for implementation of increasing vegetation and canopy cover in urban areas. And I think, I don't know, James or Pritpal, if you have a response to that.
Or we can put it in our little survey for
Yes,
next
but
steps.
but I think what we'll do is we're taking everything in that we're getting from folks, and we're gonna include this in our work going forward. Jean, one question was sort of when we are if we have a timeline for going forward, when we might be doing additional work on this.
To be honest, we wanted to have this webinar to get a little bit of feedback. So
Yeah.
what I think we would ask is, I just put my email in the chat. If Pritpal, James, and Marjorie could put your emails in the chat. But again, we want to hear from you. You can say nice things and that you thought the webinar was great, but really what we want to hear from you is what additional analysis you think needs to be done. Are there other functions that you'd like to see in this? We will send out a little online survey to ask you these questions too. And then certainly use of it in applications in terms of whether it's agriculture or environmental justice planning, would be things that we would look to partner with any of you on in terms of applying it. So if you're someone that would like to apply it and work with us in a collaborative fashion, where we'd be really excited to do that.
I think there's just one more question that maybe we can clarify for Deirdre here. James, she asked about mentioning that you use NOAA's US climate normals for weather data, the 30-year data set. And she asked if there's a reason for not using the recent supplemental 15-year data set.
There really wasn't too much of a reason other than I just went with a climate normal because it's quote unquote normal for the 1991 to 2020 period. There is argument that using a shorter time frame may be more reflective of our more recent exposure, which I could see. But for now, I just want the normal, but I could definitely be persuaded to update that to a more recent 15-year period.
Great. I think we're good, Jean.
Thanks. So everybody, thank you so much for joining us. Matt Drews, thanks again. Thanks to our friends and colleagues at Rutgers University who helped to build this. Our friends and colleagues in the State Department of Health, Environmental Protection, School of Public Health, who peer reviewed this for us. This is just the beginning of a conversation. And, we weren't sure if anybody was going to join this webinar. And look, 147 of you have hung in till the end. So that's amazing. So we will be following up with all of you. Have a great weekend.
Thanks, everyone.
Thank you.